The numbers don't look good, and in fact, they aren't. Is there still time to bend the curve, and how to do it? An Arkansas medical community under intense pressure that seems destined to grow. Hospitals and nursing homes, of course, but the providers and caregivers who keep them running. The doctors, the nurses, the therapists, and technicians, can their coping skills continue to match their clinical training? A healthcare system stressed as rarely, if ever, in our lifetimes. An assessment from three professionals coming up on Arkansas Week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. The trend line, steadily higher. The bottom line, it's getting worse. Of course, we're talking about the coronavirus, COVID-19, which has claimed more than 250,000 American lives, more than 2,300 of them in Arkansas. New daily cases that once numbered in the dozens can now extend to four figures. Along with them, unprecedented stress on Arkansas's healthcare system and the people who keep it running. Physicians, nurses, therapists, technicians. What now? We're joined in this edition by Dr. Patterson, Chancellor of the University of Arkansas for Medical Sciences, Jackie McEwen, Vice President of the Arkansas Nurses Association, and Bo Ryall is Chief Executive of the Arkansas Hospital Association. To all three, thank you for being here. Dr. Patterson, let's begin with you. You have more than enough COVID-19 patients, but the suggestion is you're about to get a great many more. Speaking just for UAMS for a moment, are you prepared?
We are prepared, Steve. This is a challenging and unprecedented situation for us. The good news is that we've had some time since the first peak of COVID-19 to prepare for this surge. We have surge plans in place. We're actually at phase one of our surge plan, meaning that we've opened up an additional unit to manage COVID-19 patients, but we have additional tiers of surge capacity to tap into. So I think that we have a good plan in place. Our challenge is that as a statewide resource, we're also dependent on the capacity of other hospitals. And we're now finding that we're in a situation in which smaller hospitals want to send patients to us, both COVID-19 and non-COVID-19 patients, for higher levels of care. And because we are now constrained in terms of our bed capacity and staffing capacity, we're not able to take every single one of those transfers that we need to. That's going to be a problem that accelerates, and that's going to ripple throughout the state.
Well, in terms of UAMS only, sir, you have been able to do this, expand your facilities there to handle the COVID surge, but at some cost to other programs there?
Absolutely. We on Monday will stop doing elective procedures that require an overnight stay because we want those beds to be available for people who are acutely ill. So this does have consequences. It has consequences in terms of the care that we provide. It obviously has consequences in terms of our financial stability. So we're having to manage our costs very carefully and be conservative. And it's difficult for us because we divert resources to things that we don't always typically have to do, like screening patients who are coming into our facility, additional PPE that are needed to manage patients. All of that together diverts resources away from our core missions at time. And we're being as careful as possible not to let this interfere with our educational role, our role in doing research for people in the state of Arkansas, and our advocacy role.
Over to Bo Ryall. If you would, Bo, Mr. Ryall, pick up on that. How's this ripple effect that Dr. Patterson mentioned, how's that being felt out in the state, your member hospitals?
Well, all our members are feeling the definite pinch of the hospitalizations. So just this morning, we reached 905 hospitalizations for COVID statewide, which is one of the highest numbers yet. We've got 356 COVID patients in the ICU and 147 on ventilators. So hospitals are stretched thin. They're managing what they have right now, but certainly it's a stressful environment. The staff is stressed. The system is stressed. And we're hopeful that we could see these numbers go down, but we don't see any indication of that thus far.
Well, just to press just a moment, Mr. Ryall, how thin, when you say you're stretched thin, how thin is thin? What does that mean to the consumer, to the areas that your hospitals serve?
Well, we're able to handle right now, but I think we know there's a lagging indicator of the number of infections out there. As we see 1,500, 2,000 infections a day, we know within 15 days, 30 days, we're going to see hospitalizations increase. So we're concerned about that. As I said, we're managing what we got now, and we're able to transfer within the system, but we need to get these infections down.
Well, staying with Mr. Ryall for just a second, Dr. Patterson mentioned the staffing issues that I gather are bedeviling every hospital, every clinic across the state. Give us an update on that. What is exactly going on here, and where's the need the most available? Nurses, technicians, therapists?
Certainly nurses, ICU nurses are certainly in high demand. We're in competition not only here with each other, but we're in competition with other states as Texas, Louisiana, Missouri, all these hospitals surge, states and hospitals surge at the same time we are. There's a competition for those ICU nurses, for example. But then there's also, we're trying to retain our own, and we're competing, trying to gather others, but they're competing, trying to gather and recruit our nurses. So, and then we also utilize travel nurses to fill in gaps. And the surge has created competition for travel nurses across the nation. We've seen the demand go up in the last 30 days for travel nurses 62%. So that takes the cost up, that takes the demand up, and makes it a struggle for all hospitals.
All right, Ms. McEwen, let's go to you. You speak for the nursing community in the state. Have you seen a stress level like this before?
Yes, sir. Nurses across the state of Arkansas, they are working tirelessly. They are really trying to make sure that all environments, hospitals, nursing homes, schools, any healthcare facility are safe for patients and for themselves, but they are tired, Steve. You know, we touched on, Mr. Ryall touched on having travel nurses in our state, and that is accurate, but I have to be honest, those travel nurses are just kind of replacing those nurses that have retired or have chosen to leave the profession because of the stress on the nurses.
Now, if we can, let's take just a moment, and Ms. McEwen will stay with you. Some of us, frankly, had no idea what a travel nurse was until this COVID came along. Basically, we're talking here about freelance nurses that may be in Kansas, in Michigan, in Arizona, but take temporary employment in Arkansas, correct?
Yes, sir. So we are pulling experienced nurses. They're not new nurses. They're experienced in whatever field we need them to be in. So ICU is a big one to help with the patients that are on ventilators because we need those experienced nurses to help take care of our patients here in Arkansas.
Dr. Patterson, back to you. This, setting aside the Arkansas numbers for a second, let's stay with them for a second. Your colleague, your CEO there, at the hospital itself indicated yesterday, I think in a message to the trustees, that he sees, or am I pushing too much here, fears of an exponential growth in COVID patients.
Yeah, that's simply the way that pandemics work. The way to think about viral transmission is that the closer you are to somebody else that has the virus, the more likely you are to get infected yourself. And if there's one person near you who's infected with the virus, you have a certain percentage likelihood of becoming infected. But if there are 2 or 3 people around you, that rate of likelihood that you're going to become infected increases substantially. We're getting to that point where the concentration of infection within the state makes it virtually impossible for somebody to be in a room with 4 or 5 other people and not to be assured that none of those individuals are infected with COVID-19. So it's simply a math issue, and we have flattened the curve with the governor's mandate to wear masks, but the truth is that we are at a point in this pandemic where it's quite possible, especially with the Thanksgiving holiday coming up, that here in Arkansas, we could see doubling or tripling or quadrupling of the number of infected cases. We could see that rate of increase happening not over months, but over weeks.
Well, have we flattened the curve here, Doctor? Are we even close to it?
Well, we have flattened the curve compared to our predictions prior to the masking mandate. Recall that back in June of this year, we were projecting that we would see a surge in October or November. We are seeing that, but the surge is not at the level that we had anticipated before the masking mandate. So yes, the masking mandate has had an effect. We know that masking mandates work, that they are beneficial, but we still have too many people who don't appreciate that this is life-saving, that social distancing is important, and we need to especially understand, as we have gathered information about COVID-19, that the most dire place to be in is an enclosed environment, often a family gathering with small numbers of people, 10 people, 12 people, and that's where we're seeing accelerated rates of transmission. With the Thanksgiving holiday coming up, it's a very, very high-risk scenario.
Well, the rate of increase being what it is, though, and we're set, I think in the last week we've set case records for, I think at least two of the last several days. So
yes.
Are we not seeing substantial growth?
Oh, we are seeing substantial growth. There's no doubt about that. We have seen the benefits of the masking mandate.
I guess, Doctor, not to interrupt, I'm sorry, but I guess I'm talking about the trajectory of the disease itself, the caseload itself. Is it not soaring?
Oh, it is. It is. I'm not arguing with you at all, Steve. And I think that's why we are at such a dangerous time right now. It's dangerous because of the health consequences of COVID-19. It's dangerous because of the economic impact of COVID-19. And it's dangerous because of the potential, if we don't do more, that we could gridlock our healthcare systems.
Okay. Doctor, the governor announced on Thursday that he's going to mandate a closing of all establishments that sell on-premises cocktails or on-premises alcohol. Is that enough? Is that far enough? Or would you like to see the administration become more aggressive?
The governor's taking this very seriously. I'm very supportive and happy to see the step that he took. He's got another press conference coming up this afternoon. I anticipate that he's going to continue to evaluate the situation. I do encourage our elected officials to think about additional ways in which we can maintain social distancing. And I also think it's so important that our elected officials, in a unified way, explain the adverse consequences of COVID-19 and the benefits of following the guidelines and mandates that have been implemented. If we can simply mask up, maintain social isolation, avoid gatherings, those are the 3 things that we need to do to prevent this accelerated phase from turning into a healthcare disaster.
Mr. Ryall, Ms. McEwen, whoever wants to take this first. There was a communication yesterday. I think it was widely reported. It's now more than, I think, 350 Arkansas physicians have urged the administration to do a great deal more than it has. Ms. McEwen, your thoughts on that?
I would strongly encourage people to follow the guidelines that have been set forth by the Arkansas Department of Health, as well as the CDC. Dr. Patterson hit it on the head of the nail with what he was saying. The masks are very important. I know that they can be cumbersome for some people, but they truly are very important. Washing hands, doing that simple hand washing hygiene multiple times throughout the day frequently, making sure you're not putting your hands to your face and wearing those masks. We have to protect not only yourself and your loved ones, but we have to protect our healthcare workers. And I think it's important to realize that when our healthcare workers are getting ill or being put on quarantine, a lot of this is happening from outside environments. It's not happening in the hospitals or the healthcare facilities, because the hospitals and the healthcare facilities across the state are really taking this seriously, and we need to continue to take it seriously. So I encourage everybody to follow those simple guidelines to help others and maintain that social distancing.
Bo Ryall,
but it is increasing.
Bo Ryall, in behalf of your member hospitals, would you like to see public policy be more aggressive in Arkansas?
Well, I know Dr. Patterson and I both are on the winter COVID task force, and we've been meeting this week and certainly have presented some options to the governor to consider. And certainly he's considered those and taken the first one yesterday and closing bars at 11 p.m. So it's a measured approach. It's looking at the numbers of hospitalizations, looking at what will be effective, what's targeted. So we trust that the governor is going to make good decisions moving forward here.
All right. Dr. Patterson, if I can come back to you. The numbers nationally have not seemed to budge much. A country, the U.S., that has less than 5% of the world's population consistently has 20% of the world's cases and about the same percentage, about 20% of its fatalities. What's the problem? What is our national problem here?
It's a national problem. It's a predictable problem. You know, viruses don't take sides, but they have a tendency to find people who are disadvantaged. And this is turning into a rural problem across the country. It's a challenge for everyone. And, you know, frankly, I say if I wanted to articulate one issue that has hampered us, it's both lack of a federal plan in place for testing, contact tracing, distribution of resources, and more important than that, lack of a consistent message at the federal level that this virus is a deadly virus, that it kills people, and that we have to do a better job of managing it until we get to the point where we have vaccine, other therapies that can mitigate the consequences of COVID-19.
Yeah, I want to come back to the matter of a vaccine in just a second, sir. But earlier this week, I think it was the White House task force that warned that, specifically mentioning Arkansas, we're on the precipice of a rapid, accelerating increase. And then a couple of days later, Mr. Pence, who chairs the White House task force, I believe, said we, and I quote, "America has never been more prepared to combat this virus than we are today." Do you agree?
I agree that we are more prepared than we were earlier in the course of this pandemic, but we are not where we need to be. We are absolutely not where we need to be in terms of distribution of resources. We're not where we need to be in terms of availability of testing. I talked to my peers earlier this week, CEOs in healthcare institutions across the state. And there are limitations in the ability to get test kits, even to this day. There's no reason why this should be the case.
Yeah, Bo Ryall, it's your member institutions, a lot of which are doing testing. Are they, well, to include testing kits and PPE, personal protective equipment, are they adequately equipped right now?
Yes, as far as PPE, we've seen the supply chain get better over the few months that the pandemic has been going. So we feel like we're in pretty good shape on PPE. Testing, we have some challenges there, not great challenges, but reagents sometimes can be short in different areas of the state. But we seem to be doing a good job in covering those areas. I will say that in preparation for this surge, hospitals have really done a good job over the last few months of increasing capacity. ICU beds have been increased 154 since the summer. There have been an additional 174 ventilators added and 450 negative pressure beds added to the system. So they are preparing for this surge.
All right, Ms. McEwen, back to you, and that's on the matter of, I guess, morale, let's put it that way in the broadest sense. The stress, the emotional impact on nurses, on support personnel, and let's include physicians, of course, as well. And we might even mention administrators, I think. It has to be substantial. How do your members bear up?
It really is substantial, Steve. You know, at the beginning of all of this, at the beginning of the pandemic, we were considered healthcare heroes, and people provided us with food, and people had signs made and banners made, and they were really supportive of us. And the shift, there's been a shift of different perspective now. I would like to see that focus go back to being the nurses and the physicians and all people involved in the healthcare world are heroes and doing everything that they can to help support, you know, the patients and the staff. But they are tired, and they are doing everything that they can to not only keep themselves safe, but their families safe at home, because it's that constant worry of making sure, am I doing everything that I possibly can to make sure that everybody involved in this is safe? So they're tired, they're emotionally fatigued and physically fatigued.
Well, is there concern on your part or your members' part that if there isn't some relief, that patient care may inevitably suffer?
You know, Steve, that is always our number one goal, is to keep the patients safe. I think if we are more concerned about the burnout, the nursing fatigue, and nurses leaving our profession. We've already started seeing that with nurses retiring early or nurses wanting to leave. And so that is a worry of just making sure that we have enough staff, and that's good that we have the travel nurses coming to help us out. But nurses, their number one priority is always keeping everybody safe, their patients safe, and practicing within their scope of practice.
Bo Ryall, with the level of stress and exhaustion and the burnout that was mentioned, is it a concern of the Hospital Association that patient care, you might not be able to maintain customary levels of patient care?
That's not a concern at this time. Hospitals are managing their capacity right now, and we still have room to surge a bit. So we're not concerned about that. And that's the hospital's number one objective, is patient care, patient safety. So we don't expect any of that to happen.
All right, Dr. Patterson, back to you. Within the past several days, 2 companies have announced very, very, very promising initial results on vaccines. There's now an indication that perhaps by late December, distribution could begin, or at least authorization could begin. Light at the end of the tunnel then?
It is very promising. Yeah, I would say light at the end of the tunnel. It's still, a tunnel that is, non-trivial in terms of the issues that we will still need to confront. But the results from the 2 vaccine trials that have been announced so far have exceeded our expectations, both in terms of effectiveness and in terms of a very positive and favorable looking safety signal. And there's a third virus, a different type of virus, a third vaccine, a different type of vaccine that AstraZeneca is developing, and they are about to report some results, and there's indications that those will be favorable too. Now, the challenge will be how we distribute the vaccine, how we get it to the people who need it most first, how we maintain a supply chain to get the vaccine to our vulnerable populations, especially those who live in rural communities. So even once the vaccine is available, we're going to have some of the same challenges that we had earlier with PPE in distributing the vaccine and getting it to people who will need it. And in addition to that, as you know, there's this whole anti-vaccine environment that these vaccines will be released into. And it's so critical that we have a unified voice about the absolute necessity for everyone who can receive the vaccine to get one.
There is some vaccine apprehension still across the country. Are you concerned about that, Doctor?
Oh yeah, and most of that is unfounded and based on a lot of misinformation. Let's look at the studies, let's look at the data, and make decisions based on that. As I said, the data that have been presented so far indicate that these are very, very safe vaccines, and that the risk of not getting vaccinated, not just for you, but for people who you could potentially transmit the virus to, is substantially greater than any potential adverse consequence of receiving the vaccine.
Assuming a best case scenario, Dr. Patterson, and we're almost out of time, we are talking now not about a Christmas present or a Happy New Year's Eve necessarily. We are talking about a months-long process for manufacture, distribution.
We are. Healthcare personnel, frontline caregivers, will be the first ones to receive the vaccine. Our Department of Health here in Arkansas is putting together a plan for distribution that includes how we physically get the vaccine out, store it, but also who is prioritized. So I would anticipate, as Dr. Fauci said the other day, that we'll see substantial relief probably in the second quarter of 2021.
And have to end it there. Dr. Patterson, Ms. McEwen, Mr. Ryall, thanks very much for being part of the program. Thanks for the update. As always, we thank you for watching. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.